I tolerate men.
We live in a risky world, you know? Yeah. So I can say, and you know, we explore.
Men should always spend on a woman.
Appreciation is a big man.
Welcome back, or welcome to another episode of the Perspectives Podcast. Some good and bad news. This is a redo of this episode, you know. And I would like to apologize to these two ladies because, you know, it was all on my behalf, you know. We got some audio files that were basically corrupted, and then I accidentally deleted one of the main video files. So it just didn't make any sense to try to piece it together. And I'm trying now to basically raise the quality of the productions I'm putting out. So ladies, I would like to apologize to y'all for having to redo this, you know, because we had such a nice conversation last time. You know? So we'll try and recreate that magic again. So
We forgive you.
yeah, I'm sorry. I'm genuinely sorry. I apologize for that.
Okay. These things happen.
Beginning to my immediate right, introduce yourself.
I'm Chevaughn Richards and I'm the PRO at the Ministry of Health.
Hi, I'm Latoya Mathew-Duncan and I am the Nutrition Surveillance Coordinator for the Promotion Unit, Ministry of Health.
Okay, so this episode is all about the breastfeeding week, right? Now the week is coming to a close. No, right? At this time, we're finishing off the breastfeeding week. So speak to me about what the breastfeeding week is all about.
Okay, so Breastfeeding Week, World Breastfeeding Week is a global initiative where globally countries around the world look at building awareness about breastfeeding, helping to support not only women who breastfeeding but also their support individuals. So you find there's a lot of educational programs, a lot of information in the media as it relates to breastfeeding, especially by international organizations such as WHO and UNICEF.
Mm-hmm. Now, what is Breastfeeding Week all about? Like, what are the exact things y'all try to focus on for Breastfeeding Week?
Trying to normalize breastfeeding, trying to encourage persons to breastfeed and trying to encourage other individuals to continue to breastfeed exclusively for 6 months or more, which is nothing but breast milk for the first 6 months of life, not even water. Additionally, not even water. Nothing but breast milk.
So is that extreme?
Yes. It's not extreme, but it's that perfect. Breast milk is that perfect
for the babies.
Yes.
It is enough. Yeah.
Okay. So as it relates to breast milk now, what are the benefits of having the breast milk versus cesarean?
Well, there are so many benefits when it looks to at breast milk. There are benefits towards the mothers.
Yes.
There's women, and there are benefits towards the child. For example, for the babies, it helps to reduce some of the risk factors that you look at health. So it reduces the chances of them coming down with non-communicable diseases, or diseases such as hypertension, diabetes, some cancers, for example. Research have also shown that babies who are breastfed exclusively have a higher IQ, meaning that they are more intelligent. They get sick less often. So these are some of the benefits towards the baby and the mother now. It also helps with the mother with reducing the risk of some cancers such as breast cancer, cervical cancer. It helps with those directly after delivery. It helps the uterus to go back into the natural form, and it also helps to expel all those products left from breastfeeding and prevent postpartum hemorrhage bleeding. And for the country, because breastfed babies are usually less ill, you have more mommies, caregivers being able to work like they're supposed to, because they don't have to worry about missing work because baby is ill.
And less strain on the medical system and your pocket, because we know when a child is sick, by the time you visit the doctor, the drugstore, you're out sometimes $200. You know, exactly. That's the power of titty milk.
So, all right. Nowadays, right, most mothers are working. Like, we have younger, extremely young mothers. I mean, I think we always had young mothers, but these days the grandmothers are also young, so the grandmothers are working. Sometimes it's basically more convenient for them to just deal with the cereal, you know?
Well, the same thing with express breast milk.
Yeah.
If you have to do formula for babies, you have to go and prepare it. You have to
Boil the
put the right
water.
amount of water.
Make sure the water is sanitized properly.
Yeah, but so some would say that's readily available.
But that's the breast milk. The breast milk is readily available. Once you express breast milk, for example, express breast milk can stay out of a refrigerator for up to 4 hours.
When I say express breast milk, you mean
Pumped breast milk.
Yes, so you can do it manually through a pump, what is known electronical pump. That actually, and some of those pumps are so great that literally some of them give you like 1 or 2 4-ounce bottle in like no time.
Depending on how much you produce as well, and they're easy.
Yeah.
So what about those mothers who don't necessarily produce a lot of breast milk?
There are things you can do. Like in my experience, there are certain foods. The old people used to tell us don't drink orange juice. I think they used to say because you're going to cut down your milk. I don't know about that.
Some of them though are just myth. It is true. We have some mothers with challenges who for some reasons are the next might not be able to produce breast milk.
Yeah,
so
for whatever reason.
Those are the individuals sometimes who we would educate on formula. So we would educate them how to prepare the formula, how to ensure that the area that they use is sanitary, additionally how to properly sterilize the bottles, the nipples, etc. So we would educate them on that because we would not stop to say that everybody will be able to produce enough breast milk. You have the few numbers.
But I find though, like in dealing with even being a younger mother, a first-time mom, and dealing with other mothers, sometimes I feel like it's an excuse. Like you speak to them and they're like, that's the excuse they give you. And then when you dig a little deeper, it's like, I just can't be bothered. I just want to buy the child food. The fear is really that the breast is going to sag or whatever, because when you ask them certain things, it's not that they don't produce enough milk. And the least you feed, the less milk you get. That's another thing for them. So if they already throw the child on formula and you spend most of the time, the breast produce milk on demand.
Yeah.
So the less you breastfeed the child, the less milk you make. So it's like, you know.
Yes.
But wait, you talk about the sagging of the breast, right? that is a main concern of the younger females, you know, because in reality, the baby them just go with the breast, you know, like, and for real, the babies go with the breast. Would you not agree?
I mean, I remember during the last thing, which, we had an extremely vibrant discussion.
Yes.
And so these are one of the things, and I share everybody's sentiments, because of course it's a body part.
Yes.
And it goes to some use, and so eventually after use, it might look a certain how, but the breast, usually the functioning part, what I like to tell persons usually is, most of the time it has nothing to do with breastfeeding. We have persons who have saggy breasts and they have never breastfeed. The functional, breastfeeding, what I like to focus on, especially when it comes to breastfeeding, is knowing that regardless of the size of your breast, there's nothing to do with the functioning of the breast.
No.
So you try to tell me, there are people out there who have the elongated breast without breastfeeding.
Yeah.
That's unfortunate.
Sometimes it's genetics too. Some people start sagging in the teens.
As we start to age, skin turbo and different parts of your body are going to also age. The breast being one of those body parts of
gravity.
Going to age.
How I look at it, right?
Oh, and if they know where the bra to
proper supporting.
Proper support. Yeah. And diet, like it's skin. Skin that's not well taken care of, moisturize your collagen levels and stuff like that. Any skin, if you have bad nutrition, I find affects your skin really, really badly, and that's when you get this sagginess. Not even just the breast, the buttocks, everything start looking kind of loose.
In the breast, usually the size of the breast, but through the index, and it is fatty tissue.
Yes.
So that is usually what shows really the size of the breast.
Yes.
Some might be bigger than some. It is just
It's not the
fatty
bigness
tissue.
of the problem, man.
But the bigger you go,
It's
usually the
But
more
that
weight.
usually that thing
It's not the
with
bigness of the
size.
problem. It's the firmness. It's the firm. I mean, we don't like the silicone level, but you know, you understand?
I
I
find no because
You
okay.
understand? You know, follow.
Of course I follow.
I feel
and-
like
and-
exercise, different things also, because women who go and they start toning the muscles underneath, they do get a little lift, and again, diet and other things play a part in the firmness of the skin as well. And nothing wrong with
With
going
the breast,
the other
with the
route.
breast, and it's a natural cancer. Okay, it's totally a natural cancer.
I'm sure all of us had
The
it.
thing is, the main usage for breast, especially for women, is not for physical.
Yes, and
thing.
yes.
It's food for your babies. It's here to nourish your babies, so that's what
Yes.
you feed them. The normal processes, you become pregnant, your breasts have some changes, you go through the different changes, and then when you have baby and milk is produced, and so the size of the breast usually changes, especially after delivery. So you might find somebody who had much smaller breasts, the breast will tend to increase in size. You know,
And we do gain a lot of weight
yeah.
in pregnancy too, right?
And because of the additional weight gain, the additional fat, you might find some of those might be a compounding, a factor as to why the breast might look like that. But
Well, I mean, for me personally, if it is me get somebody that are pregnant and the breast begins to sag, I mean, we have to just work with that
You
because
have
that's
to.
my creation at the end of the day. But for the ones where kind of have it
because some
without
men,
the child,
some
I
men
mean,
do have breasts too. But just that it's not.
And some of them sag too. A lot of men out there have breasts.
Even though we're
what do you
speaking
mean by
about,
man have
even though we're
breast?
speaking about breastfeeding, you know,
Get
men
fatter now, you
also,
see.
men also can get breast
Yes,
cancer.
yes,
They
men
don't
will
call
get
it
breast
anything
cancer.
else.
Mm-hmm.
It's, you know, it might be true that they might not have some of the signs like what women do have, but men also have breasts, and men can also be diagnosed with breast cancer.
So as it relates to the breast, right? Earlier you said the breastfeeding itself helps with preventing cancer, right? The breast cancer.
Not for the men.
Does the sucking of the breast by maybe
Oh, Lord.
your partner
No.
helps?
No, it's more related to the functionality of different hormones, things that are done internally and not what are done externally with the breast. Like the sucking of your breast by your partner, that does not count.
So at the Ministry of Health, y'all don't promote or encourage or support the sucking of the breast.
By whom?
I would
Only
not say we do not
we don't promote
support it.
all of that is human
That's
nature.
sexual health.
Yes,
And
that's
if
sexual
somebody's
health.
preference, then if somebody's preference, we would just educate persons on how to probably take care of the breast, how to keep it clean. But I think that's a conversation for our sexual health educators who I'll probably invite here, and you can probably ask them that question. But we promote all of these are needs.
Let's talk about breastfeeding. Okay. The baby is the one who is supposed to get the milk, right? But there are some people with that fetish who want the breast milk too. Like your partner would like that breastfeeding experience.
Absolutely.
So is that the same benefit the mother would be getting? Because they say breastfeeding have benefits to the mother. You know?
So what you're saying, if the father also goes and drinks the breast milk too? That's what you're
Yeah,
asking?
the father
The mother would only be able to produce breast milk if she had a pregnancy.
Yes, if she
Yeah,
was.
but I'm saying, the baby is there, right? A little more breastfeeding might not hurt.
Yeah, well, of course, as Mrs. Richards said, supply and demand. So the more she sucked, the more milk she would have.
Yeah, and the body is not responding just based off the baby.
You know, there is some papers I was reading, some studies done that say that when the child latches, the saliva in the child, and it interacts with the breast because they say we're such sophisticated machinery, right? That it actually tells the body what nutrients the child needs more of and so forth. So they're showing you that baby and mother are so interconnected that when so that's why it can tell
So no breastfeeding.
produce more. So I don't know.
Adult breastfeeding.
Well, breast milk is good in adults for different things in cancer treatment. Men who have cancer, they have these things called the milk bank, and they use breast milk to treat other things.
My promotion of breast milk is for the
kids.
feeding of the babies. Feeding of the babies. And like Mrs. Richards was just saying, that's another useful topic and something that persons can explore. For those mothers who you mentioned earlier who have challenges, there are some countries that allow donor breast milk. So you have individuals who can actually donate breast milk to a mother who are having challenges, who experience challenges with breastfeeding. Of course, it would go through a screening process.
Of course, for diseases and so forth.
It's just like donating blood.
Just like donating blood, yes. So we have countries who actually promote that. That's how important breast milk is.
So you speak about the cereal. What about cornmeal porridge? Because of that, most of us grow up on it.
Well, I did not come up on cornmeal porridge, but cornmeal porridge, I didn't come up on cornmeal.
You're the Caribbean.
I can't.
No, you don't come from the Caribbean, man. You're acting bougie.
No, I don't eat cornmeal porridge, but no, not as a baby.
Why not?
Not as a baby, I don't know. Maybe mommy just wasn't into the cornmeal thing. But
what about you?
We had what we had.
I don't remember as a baby we had breast milk
and then you had the pure and the mashed and stuff like that. So very early.
My mother, you say kids here, people do it, but it's just some don't focus. Like because from Sunday Point, I don't know.
I don't know. No, I'm just saying.
We had porridge in between now and again, but like even my younger siblings, I didn't see my mom give them no cornmeal.
During my period when through discussions, the focus was more so on like mashed starches, mashed potatoes, mashed sweet potatoes, pumpkin,
the pumpkin especially,
things like that. And all of these education sessions were done through the health center, so the nurses used to provide all of these excellent resources to the mothers, which we still do after breastfeeding, exclusive breastfeeding up to 6 months. You introduce what is known as complementary feeding.
Yes.
So this is where you start to provide them with certain meals that you would prepare for the rest of the family. However, in a method that is easy for the baby to digest. So you would mash it or you would pure it and you would feed it to the baby.
So cornmeal porridge is not
cornmeal porridge can work after the 6 months. Most porridges can work. And as a matter of fact, what they can even do when making their porridge is express the breast milk and use the breast milk to prepare the porridges. Whether it is cornmeal porridge or whichever porridge that individual chooses.
So you're saying it's basically not recommended for
babies below 6 months.
Yes, because
I remember last time you were saying it's basically difficult to digest for that young child.
And it's not only cornmeal porridge, even some of the formulas, for example, that are produced. For the babies to digest it during that stage, it's really difficult for them because of some of the protein that's inside of it. However, breast milk having everything that the baby needs, and it changes over time to accommodate the baby up to when the baby is 6 months. So you no longer have to be reading a label and a formula to say, well, it is 3 months now. So
exactly, that's the next thing.
No, breast milk adjusts itself naturally to support all the nutritional needs for the babies. That's why not even water is needed because I have enough water in there to maintain the baby.
That's right. I believe you because remember the baby was in there for 9 months feeding off whatever the mother is providing. So naturally, if the natural order is you come out and you suck it for a while.
Yes, that's the natural order.
So as it relates to breastfeeding, right? Sometimes females or younger mothers would be afraid to breastfeed in public. Yeah? And then you have someone anyway you can find them on the bus just flip out the titty and what's recommended?
Well, if the baby want to feed, we recommend feeding on demand. Baby-led feeding, which means when the baby wants to feed, you feed the baby.
You ever had a baby that hungry and you don't want to feed it?
No. Well,
that's the biggest battle you have.
I breastfed exclusively. So what I used to do, honestly, if I did not have express breast milk prepared, because if I'm with baby all day, I'm not going to express milk. I would put my baby to the breast. So sometimes I would go back to my vehicle, depending on where I'm at, I might get a little corner. You know, I put the baby blanket a certain house so that it's not exposed.
They have these stores as well.
Yeah, I'm going to choose my outfits that I'm going. I usually choose those that are easily accessible for the breast. So I would take out the breast, of course, I would just fling it out there, and I would
It depends on the individual,
but I'll feed
So you
it.
hide the breast then. You hide
Well,
the breast.
I'm not hiding it. I mean, I'm not telling
I feel like
anybody to.
it's your
choice.
preference.
I feel like breastfeeding breast is supposed to be proud of.
Exactly, thank you.
Yes,
And I agree
proud of the breast.
110%.
Yeah, don't hide up the breast because it's nothing. There's nothing
Yeah.
sexual about that.
I don't
encounter.
think so
You're
either.
feeding the child.
You
You're not
feed the
supposed
child.
to. You're not supposed to. Vexing and suffocate the
But
child.
by the
No.
time the child reaches a certain age, right,
Yeah.
they start flinging off the blanket.
Yeah.
Right.
They don't, like I remember
By
I was
right.
in the supermarket with my daughter. She was already 1 and she's in the cat and she want breast. And I'm like, no, and then she's, you know how they get. So I had to take out the breast while I pushing the cat and she feeding. Go around the corner, another woman around there doing the same thing, right? But this guy came up to me and he was a Rasta and, he was like more conservative. So I was like, Sister, I don't think that's appropriate. That's your breast. And I said, well, today, while I breastfeeding, is Titi Debbie. When she stopped her breast, they become breast again. When she stopped her milk, they become breast again. It's not sexual. That's the purpose of breast.
Yeah.
Right.
So you're supposed
the
to, when the baby
purpose.
wants to feed, you feed the baby. But it's an individual thing. If you're
Yeah.
comfortable like Miss Richards in the supermarket,
It was either
but
screaming and more attention.
Whenever it's baby-led feeding, so whenever the baby wants to feed,
Yeah.
you feed. Because imagine having a screaming baby. And the thing about
It's
babies,
stressful.
especially when they are younger, you don't want to wait until they get to that point where they're
No.
kicking and screaming
And
to
then they
start
get gas.
breastfeeding.
Jesus.
You want to actually know the cues, when they start to suck on their finger and they start making smack sounds, are those who know how to pull for the breast to know baby is ready to feed. There's the thing that is known as baby crawl. There's a video on YouTube, several of them, where as the baby is just delivered, it's put on the mommy tummy and the baby literally kick and navigate itself up to the breast and start sucking without anybody putting the breast towards the baby. It's just the natural process of it.
I had that, right? When I had my daughter, I was so terrified when I went by my mother's house, didn't go home, went to my mommy's house. And I remember I had to sleep in a bed. We thought it was a very big bed, but I was so scared. But they had encouraged the skin to skin and stuff. And I remember being in the night, like I edged way far because I'm afraid, because she always been in the crib. And then in the night between sleep and wake, I'm feeling like almost like your skin crawling, like something touching me. When I looked, the child was right up underneath me. And I'm like, when I watching you, you're moving. How you do that? That explain.
Yeah, the baby.
She reached all the way up to the breast.
Literally, so the babies are born already with the instincts to know where to feed.
Yes.
So the baby literally, nobody positioned the breast for the
No.
baby, nobody showed the baby where the nipple is. The baby just born, came up, placed on the mommy tummy, and the baby would, as we would say in lemon terms, kick until that baby get to the breast and just start sucking. Grab the breast itself and just start sucking.
Yeah, it's a natural order.
Natural order.
It is
Yeah.
beautiful, and I will tell fathers as well, be a part of the process. I know sometimes, we have things like, we have to be realistic. You get a baby with a man. It's not you alone that impregnate yourself. So it comes from some sort of relationship. And men can feel left out. As you said, they might say, well, the breast is not as firm, this, that, she spend all the time with the child. But it's your child. And if a man is as involved and as in awe as the woman, he ain't got time to feel like you left out. Because if you're there with her, there's a ghost part of breastfeeding, but we have to share it. When you're pregnant, your nipples mine got really crusty. They got bigger and slightly, and they had like skin. And I remember being confused, and because when my husband went through this, like we would say we are pregnant, and we went through that, we look at all the stages, and he was as involved, and because it's your child going as well, and if you put in that, we went to the nurse and she was like, oh, that's normal, and she gets some Vaseline and she oh God, the pain, she clean them off and everything. And after that, whenever they would start getting that, because he was a part of the experience, he would come and he would help me rub them off and stuff. He would do certain things. And it's as if he went through the pregnancy as well. So I'm encouraging men, there's nothing feminine. It does not take away your manhood to be involved in the pregnancy and be involved watching the child. Children trained, I swear, like every 2 weeks, they have a major change. Like they go through so many changes so fast. So as a man, be a part of that.
Yeah.
I encourage that
And
also.
it's important but also one of the areas that you just touched on is care of the breast before pregnancy, ensuring that you clean the breast properly, ensuring that the areas is moisturized. You don't necessarily have to use Vaseline, because Vaseline actually sometimes help to create that layer.
Yeah, well, she did that. I'm a natural person, but
I try not to.
after that, I would use all the natural stuff.
Too much manipulation of the breast before actually the baby is born, because some of the changes with the breast would only happen after.
After I got it was.
So some of the changes, sometimes you might see a lot of things obvious, before the baby is born, but then after delivery, you just see this whole change. Your body just start to adapt to facilitate feeding this baby, because breast milk is food, and we need not look at it like bodily fluid.
No,
it's food. It's what the baby feeds on. Okay.
So speaking of what the baby feeds on, is it recommended for mothers who are breastfeeding to drink alcohol while breastfeeding?
It's not recommended. I mean, there are guidelines to how much alcohol persons can consume, how much a female and male can consume based on the percentage of alcohol. We say the name of the alcohol, for example, but usually alcohol for breastfeeding women, pregnant women, is not recommended.
And I mean, like I said before too, for transparency, even with me, like you have December time, you might want to have, especially when your child is already, you didn't have any alcohol for 9 months. You didn't have any.
Some people do,
Okay.
No, for
it's
real.
true. Some persons don't stop.
No,
Oh,
for real.
wow.
I tell you, some people do, because
True.
somebody would tell me straight up. She was on her second child, and she tell me straight up she drink right through with the first one and nothing to it, and she gonna drink right through for the one and nothing go on to
Well, that's
it. And
extremely
she had a healthy
dangerous.
baby for the second time.
That is
So she
extremely
had 2 healthy
dangerous.
babies,
So
and she drank during the pregnancies.
we would not recommend
Well,
that.
I would not recommend it. I mean,
And,
sometimes you might have some individuals who are lucky enough for babies and born with alcohol syndrome, etc. But I would not recommend
No.
it.
So there's alcohol syndrome.
Yes.
There are babies. I mean, I don't know, but
The
when I
born
was
drunk.
younger,
Sorry.
that's why I was.
The born drunk.
They would say, you hear my mother answer, they look at some person and say, yeah, she baby gonna born drunk, born drunk, because of their person being alcoholic, having suffered with that disease. So persons assume that. So there are some fetus that would actually born with certain characteristics, and individuals can tell that that is a side effect from the mother consuming too much alcohol during pregnancy.
Not too much, any alcohol. I don't suggest any mother.
But I would say, like, as your baby gets older, I wouldn't even say between the first 6 months there. But as your baby is getting older, and say in December, like I said, what if you have a piece of rum cake? Some people, rum cake could get you drunk, and you may not have thought about it because it's cake, but there is some leeway in there if you expel the breast milk, if you store breast milk, because then it takes a certain amount of hours for the alcohol to leave your system. So if you had breast milk stored, what they suggest is that you feed the baby from that stored supply, not from your body, because you would have ingested the alcohol. And then after a certain amount of hours, it would have gone from your system. Then you go back to feeding baby through the breast. So, I mean, life is not perfect and people have different things. But if you are, say it's your birthday, something, and you are considering having that, consider pumping enough milk for your child to accommodate for those hours that you cannot have. You cannot feed the child because you've been drinking. Everybody is not alike. I agree.
But I think you could. I think you could probably have your food cake. I mean, some people.
Hello?
I think you probably have a piece of food cake.
Some people don't have a half.
You're encouraging bad behavior.
No,
How about
I'm
you
not
just
encouraging
listen,
alcohol.
How about you just not have the rum cake for this Christmas?
Okay.
There will be multiple Christmas.
So don't have
ahead.
the rum cake for
You
Christmas.
had multiple Christmas behind.
Mhm.
What about
Yeah.
the birthday? You're not gonna have no birthday shots. It's just one birthday.
Yes, I agree.
And why is it that we want to drink every time we celebrate? We want to do things to our bodies that are not good for us. You have the cake that's full of the sugar that's not good for us. The alcohol. After your birthday, you look tore up because you had all this alcohol and you're dehydrated. Why? I always wonder about that. Why do we celebrate with destructive behavior?
Well, some individuals do not have. But it's wise, like you said, to just not have.
Yeah, I wouldn't have it, but again, life is not perfect and people are different. And
What about
Yeah.
smoking?
oh God,
Well, smoking for so many other reasons, but
yeah.
when you think about smoking, persons only tend to think about cigarettes, for example. But here in our culture, let me be careful how I say.
Women smoke.
Yes, women
Yeah.
smoke, and we have one where women smoking, but we have one where women smoking marijuana and not so much cigarettes.
People in general, I feel like St. Kitts Nevis, we don't have much cigarette smokers. Like in other cultures. Like, for example, in Jamaica, a lot of young people smoke cigarettes. But here, hardly any, I haven't seen much young
No.
people smoke
It's cigarettes.
They smoke
Cigarette isn't
marijuana.
that thing.
Marijuana, yeah.
And it's not recommended for any type of smoking.
Any
During
type of
pregnancy
smoking.
or
Type of
after.
smoking.
But I
Because the
see a
thing is,
lot
you're
of
not
women
supposed to
smoke
literally take
marijuana.
in any smoke. You're
Yeah.
really not supposed to be
Exactly.
inhaling smoke, whether it is marijuana or even commonly used herbal teas that we use for teas, etc. You're not supposed to take in any smoke in your body.
Right. Because enough people feel like it's only cigarette that the problem.
No, it's
People
not.
feel like it's literally cigarette that the problem.
I'm so glad you said that.
And my thing is, if you're dealing with marijuana for the medicinal benefits, the minute you light it a fire, all of that go through the door. That's all I see.
Mhm.
You know what I mean? The minute you burn something,
Yeah.
how can you be looking for medicinal benefits from that? You know, you're lighting it a
You
fire.
light it up.
You're destroying it.
Well, I don't smoke. They say sometimes I'm not sure if it's a THC or whatever, because there's a shorter distance, like the membrane between the nose and the brain. They claim so when it goes up in that form, you get the high quicker. But if you ingest it and it goes to the
That's
liver,
true.
it's a bigger, longer high. I've never smoked
because-
No,
it,
the smoking for
I've
real.
never
That is a
smoked.
fact. You know.
Yeah, and some plants.
but I
Because
feel
we used
like
to smoke.
And
Yeah.
that is the issue we have with some plants. It's
Yeah.
not just marijuana.
Yeah.
In order to know literally how the body break them down when you consume them, more research have to be done. So we don't have a lot of research to back up some of them. But one thing that we can say for sure is that smoke has knockers inside
in
of
your
the body.
lungs, yeah.
Especially
don't-
in a pregnant woman. I mean, a man or a woman who is not pregnant or not breastfeeding.
Bad enough.
You can do what you want to do with yourself, but you know have the responsibility of a child. The child has no say in what you're doing at this point in time. So I would encourage people to express caution in that regard.
And then even the handling of the baby, because one of the things we want to start bringing awareness to is infant care, proper handling of the baby. And as you would have mentioned the last time about, when you go with the baby, the shaking of the baby, how you handle it could actually damage an infant.
Right. Go a little bit in depth with that, because it's just saying handling of the baby and shaking of the baby. Give me an example of how you can unintentionally damage the child.
For example, we have, like even earlier this morning, I watched on Facebook, there was this video that says when your favorite uncle comes over, and the baby was there in a sort of blanket, and he just grabbed up the baby in the blanket like a bag. And then there was this gentleman speaking, sometimes we'll rough up our babies and things, it's normal. But sometimes you can be too rough. You have to remember that these babies are a lot more delicate than us, because they are still developing. Their organs, for example, they are a lot closer to
The surface.
It's a lot easier for them to be damaged. Their brain, for example, when babies born and you feel the soft spot up here, the fontanelles, it is still not closed up. So sometimes you might observe the soft spot up
When
here
they're
in some
breathing, you
babies'
see
head.
it. Yeah.
Yeah, so sometimes there are some areas that the simplest of pressure on a baby body could cause serious damage. It could, whether it could be a limb, for example, because sometimes persons rough play for real. I remember I had older family members who believe in holding up the baby them by their legs, them holding them in the ear and support really that stopping them. So some rough play could be damaging to babies. So you have to remember to be a little delicate with babies. Try not to hold them too tight. Don't shake them too much.
A concern I kind of have to is with breastfeeding baby mothers, right? Sometimes, a person who is breastfeeding would sleep with the baby on the bed. Then it's easy to roll over on that child if it's on the bed with you. Is it recommended for the baby to be sleeping on the bed?
Well, it's not recommended. Sometimes it do happen because breastfeeding and having a baby, especially in the earlier few weeks, is not easy.
No.
So sometimes you'll find the mothers that might lay down lateral position and they put the baby to feed. So we always encourage persons, if you are going to do that, have somebody there to support you.
There's father again.
If you are that tired, that exhausted, don't try doing that. Because other than the mommy even laying down and the baby,
she could drop it too.
Aspirate. As in, that baby could choke if they are not positioned properly, because the younger they are, they had issues with moving around their tongue and even lifting their head properly. So if breast milk, for example, or whatever the baby is being fed with, that baby is not positioned in an appropriate way, that baby can choke. And you could have issues from that the baby cannot cough, the cough reflex is not properly developed in the baby. It don't happen at a time when it is supposed to, and just from the position of the baby, the body is not allowing it to. So there are so many things can happen. So we do just advise, if you're going to do that, have somebody who are going to be able to monitor you, to look in on you, to ensure that you and baby are still safe.
Again, the father is other support if you have a
okay. Not to make excuses, but a lot of times, a lot of casual sexual relationships are happening. So daddy might not be physically available to sleep over with that baby. So in that case,
I'll say this, and I need people to maybe it's a little controversial. I know a lot of people still feel that when they have a casual relationship and a child comes, there's a sense of secrecy and right? I'm of the feeling in our culture that has been going on for millennia, right? And so I'm a lot more open-minded where that's concerned. I actually had a friend and they were not together. They had the child. But when that child came into the picture, it wasn't about, well, who gonna see me over here, whatever. He actually used to go and sleep. He actually had another girlfriend, but the child came first. When the child is sick, he went and he stayed, and she would sleep in another room and stuff. But then you have parents as well.
Yeah, I was about to
your mothers
individuals
are amazing.
Friends, older children.
Yes.
Your support system.
It's a support system.
But
some people just don't have that luxury at the end of the day.
What helps for me, the only thing I could think about, there are so many little gadgets now that help you, like those, those breastfeeding pillows. They come around your waist, and they have them different ways. No way they have levels and different things. Sometimes if my husband wasn't there and I was tired, I would shift my room, put the bed against the wall so I could be comfortable, but prop myself up. She had a bassinet, but sometimes you're tired. To sit in a chair where you could fall out, the baby could fall out your hand, could be dangerous. One of the rule of thumbs too is to sleep when the baby sleeps. So sometimes you might have some babies, for example, because eventually they do sleep. It's just how and when. You might find a baby might sleep more in the day and more in the night. But sometimes, usually, you have to adjust your schedule to accommodate the baby's schedule. And that's why during the antenatal session, it is extremely important that you're educated properly, because being educated, going to the antenatal workshops, to the health centers, we teach you already how to know
to deal with babies. So, for example, if baby is content, baby is fed properly, you won't have a fussy, cry baby. So, if you are able to identify when your baby wants to feed, for example, you won't constantly have a baby feeding who have to be, if you know when your baby wants to feed, you know when your baby is satisfied, then you won't have such a cranky or fussy baby. So you'll be able to feed baby when baby needs to be fed. You'll know when baby is satisfied, and it would also help you with comforting baby. So knowing some of these cues and how to interact with baby, these actually help some individuals.
What about when you have a cluster feeder? I had a cluster feeder.
Well, sometimes you tend to have those, but the thing is, when the baby is satisfied, that baby is satisfied, so you would be able to know when baby is satisfied. Because sometimes when babies start to get more aware, you'll find that sometimes things might distract them from breastfeeding. So they might be there sucking, and then something maybe catch their attention and they look away for a little while. You know, but then they'll start to breastfeed again, etc. But once you know the cues, for example, you'll be able to tell when baby is satisfied, so you can remove baby from the breast. You know, you birth baby properly. You'll learn how to change the diapers, things like that, how to keep baby comfortable. All of those are things that help mommies so that they too can get well rested and be able to live to adapt to having a baby in the household.
Okay, so my next question is, postpartum depression is a thing. At a point in time, I never really believe it until I actually see it for myself. But stress is a thing where you can pass on to the child, right? Through the breastfeeding. Is there any support that the Ministry of Health provide for mothers going through postpartum depression?
Well, yeah, as a matter of fact, and that's why the follow-up visits to the health centers are so important. Because the nurses at the health centers, they would be able to provide assistance if needed with the mothers, part of absorbing the mothers and the babies. Because sometimes in the health institution, the hospital and the health centers, we don't only ask certain questions and look persons from head to toe, just because all of this is the assessment to know how well is this mother coping. So usually when the mothers are discharged, they usually know which health center they have to attend. And so when they go to the health center, these questions are asked. And that's why sometimes we usually encourage persons, you know, to try, it's not a must, but if possible, if you are in your area and that person is accustomed to you, that nurse will be able to say, well, Mrs. Richards behaving a little funny. Sometimes it's not always easy to tell. But if you know that individual already, you can actually start seeing some of these signs. So usually even as soon as baby is born, you are usually observed for certain things, because there are some cues, like they might not want to breastfeed the baby, or they might not want to see the baby. Everybody else want to come and hold the baby, but this mother don't want to hold her baby. So these are some of the cues that the nurses would observe and they would document. So even hopefully before it gets to that phase, we can provide some kind of counseling support for them. We do have persons who are trained in mental health areas, so those individuals will be referred as needed. So the Ministry of Health then to provide those services for those individuals who need it.
I like that, because again, it's a real thing. And I feel like sometimes it's not necessarily taken as serious until something bad happens, you know. But to have some kind of treatment or prevention for it is actually good, you know what I mean? Because a lot of mothers go through it.
A lot. And it's even more important now having the health centers do that, because it's not like before where you had the fasting neighbor class there and everybody observing and people able to look at you. People are a lot more private now. People are not interacting on the same levels, and so having that support through the health system is even more important
and
now.
that's why we keep encouraging mothers. If you're planning to become pregnant, even if you are pregnant, visit your health centers. Go and do your antenatal checkup. It's okay if you also have a private doctor. That is fine. You can go to your doctor and you still can get care at the health centers. Because one of the main rules for the health centers is to educate.
But then, you see, next thing, like with the health center thing now, right? From getting my son, we never really go to the health center during the pregnancy like that, because, you know, more with the health center thing, people kind of, you know,
The few people fast and in your
fast,
business.
and then next thing to like the nurses themselves sometimes may not be confidential with the information that they would have got.
Well, you see, that is something that I've always, and being a nurse myself, I can tell you quite often it's not even the nurses who carry out this information. Sometimes it's the client themselves, sometimes it's another client around them. Most of the time it's not nurses, because I like to tell persons.
But how another client around would get your information?
Her clients do say things and not realizing that other client could interpret.
Yes.
They might, for example, a nurse might advise you of something. Okay, the nurse finished with you, you have left the room, you may be now outside in the waiting
With the other mother.
The nurse might pass you and she might say, nurse, what you had said, do this or do that. And some persons are able to interpret from what you said, probably to what they think is happening to you.
Right.
So sometimes, but the thing about antenatal care, there isn't, it's more important for persons to get that level of education and care, because being pregnant after you reach a certain point, there is not hiding it. Okay, there is no hiding it. But the nurses, like our nurses, are confidential, and everybody is not perfect, right? But I would say, compared to once ago, where persons were less, what shall I say, information about persons a lot more focus was done on privacy and preventing persons' information from getting out. You know, it was more sort of a community
Yes.
affair. So a lot of times persons felt free to discuss certain health issues with other individuals. Okay, not only so with their healthcare worker, but also other individuals. Sometimes you find that's how that person's health information gets out.
Yeah, all people don't see the people sharing drugs. But doctor, give me this.
We have persons who actually, for different complications of the necks, they actually speak to their neighbor or their friend or another relative, and the person might say, oh well, it's the same thing I have, and next thing they start sharing drugs. And so sometimes it's not really the healthcare providers, it's not the nurse, it's not the doctor. Sometimes
you know what I find though, like I also had a little hesitancy because, you know, the culture, but I will say that especially as a female, I went there, I met an older nurse, and I didn't know her from before. She was so amazing. And when you're pregnant, the old people used to say 1 foot in the grave and 1 out. It's such a transformative experience that everything matters. And being able to speak to her, have her explain everything. They go through, she played a heartbeat, because I was there like, why come in here for? But she went through, she did all this stuff, and she was so soothing. And because she was older, she had so much experience. And there is something about when women come together. I was also delivered by 2 females. The doctor was there, and he was like, you know, they said they have it. I was like 4 in the morning. And there is something about when women are together, and a lot of nurses have kids. They would have gone through similar experiences. So when they're speaking to you, there's a level of compassion and camaraderie that you don't get sometimes outside. There was this one nurse, I remember I just had the baby, and then I was breastfeeding, and she was over there till she forgot what she was doing. She was like, because it is such a female experience, and that alone, especially if you don't get the support at home, that support from these females in that setting, let me tell you, sometimes we are so ready to go into situations and expect bad. But when you go into it, and your attitude too, a lot of times you have to remember these people are persons as well. When you go into it and you have a good attitude, I would say 90% of the time you will find people who will be supportive.
Because that is so true. And what I would usually recommend, what persons have to pay attention to, and remember that being pregnant, it's continuous. You are pregnant with this baby, that baby needs care from it's in utero to when it's delivered. Persons usually wait until after the baby to start visiting the health center. That is not when the relationship is supposed to start. No, persons feel it's a must to attend the child health clinic, because the baby would be assessed, whatever vaccines are required, you have to go there. That's when persons go, but you have to start the relationship before So it's much easier. I mean, if Mrs. Richards wait until she get the baby to go health center, it's a whole different assessment.
Yeah, because
the nurses,
you're just starting
you
to
just
build that
started. So you have to build that relationship before. So it's important that persons attend antenatal clinics at their health centers. Like I said, you can do the health center, you can also do your doctor. At the health center, the services are free.
You know,
Services are free.
you know, I think I want to touch before we finish. Teenage pregnancy, because that is another touchy thing where, like, people has be ashamed of that. You know, sometimes parents either say, for this period, whatever you're gonna get pregnant now, you're on your own with that part, like going to the clinics and so on. What y'all recommend with that?
Well, usually, depending on the age, they have to have an adult still accompanying.
Yeah, but I mean, the parent itself. I'm gonna tell you a situation off camera, but for what happened with my family. But usually, the mother or the father might say, "Hey, I have nothing to do with you now."
You mean in that sense?
But then uncle or auntie or a cousin would step in, would have to step in.
You know what? I grew up right, and my mother would always say, you don't know where that child gonna come to. And things sometimes do not happen as planned, but I'm one of those people who think that everything is divinely influenced. And if your child does have a baby at a certain age, personally know that I have a child. That she's not a baby mama, she's still my child. And I think sometimes we get so caught up because it's a small society, we care about what everybody else is going to say and how they're going to judge us. But in 10, 15 years, that child is big. You all of a sudden love your grandchild, you want to be a part of that child's life. How are you gonna feel knowing that you abandoned or refuse to support and this is the most critical stage of
because
that,
it's a teenage pregnancy too.
It's very,
and the person need to be monitored. So that's where the support system comes in. So it is even at that stage when that teenage pregnancy have started that they get the medical help so that child and the mother can be properly monitored to ensure they are receiving the best of care. In the health centers, I mean, usually for certain age, for certain procedures, they would usually recommend that you have an adult with you. And we do antenatal clinics at the Ministry of Health Promotion Unit. We actually do 2 annual sessions where we bring pregnant women together for a day and we teach them about breastfeeding, what to expect, what not to expect. And I've had in these sessions mothers who accompany their teenage daughters, and even some adults who are pregnant have their mothers with them for a support system or even their boyfriend. But one of the main things that persons have to pay attention to is accessing health care, especially when that pregnancy started. Some persons might see it simple as that: I get pregnant, I push out the baby, and that's it. But there's a lot of things happening in between, from when you conceive that baby to when you have your delivery. So between that time period, it's extremely important that persons have their checkup to ensure that nothing goes wrong. Because you don't want to wait until everything goes wrong or you feel a certain how you end up at the hospital and then.
And to, as you said, information as well, like especially, I'm the nutrition person, especially when it comes to nutrition, you want to make sure that pregnant women are eating properly, getting their, what they call them, the prenatals. A lot of people will tell you, I don't know what to eat. I still eating a boysen and $1/2 bread every day. You're eating for you and the developing baby. So things as simple as that.
Let me get a story. My brother who is 9 years younger than me, right? He just got out of high school and so. When my mother was pregnant, she usually drink Coke and coffee. Other than that, water. And the baby born black. The baby born dark. With some, like for the first 3 days when he was born, the first you see a baby born that black and he almost had some greenish things on him. So when you talk about nutrition, know first and that whatever you consume while you're pregnant, it affects the child. You know what I mean? Because me tell my little brother, she never drink milk in her coffee at all. She love coffee during the pregnancy. And the baby born dark.
That's the thing. You see the thing about being pregnant, there's still a lot of studies that are being done and relates to in utero. What really goes on inside utero when the baby is inside there. So a lot more studies still need to be done first to determine certain things. But your nutrition, your external environment, how you take care of yourself, all of those play a role. So persons have to generally want to take care of themselves because the thing, what happens when you are pregnant, whatever nutrients you have, the body provides it, feeds the baby first. Then whatever is left, the mother gets. So sometimes you might find a mother who is ill during pregnancy. Underweight, our person could say look malnourished, but she still produces a healthy baby, normal weight, etc. Because the body ensures that that baby receives the nutrients that is needed from the mother, and then whatever is left over, that's what she gets.
That's why they lose
teeth
and different things.
Yes.
I get great
another thing we touched on last time, we never get to touch on here, right? The chubby babies. That is what we love. You know? Somebody see with a baby that's small and them must say, yo, you know, take care of that baby there. Is it that the breast milk would keep the baby at the right size it needs to be?
As a matter of fact, babies that are exclusively breastfed, they tend to gain more weight than normal at their age category. The same thing can happen with formula-fed babies. However, the difference between the two of them is a healthy weight and a non-healthy weight. So breastfed babies, once they start hitting 6 months, 8 months of there, the weight start dropping off slowly but surely, and so you start seeing them becoming more taller, etc. But babies that are formula fed that also have the same weight, they just continue to gain weight unless they are being fed properly like they are supposed to. So you have persons, so most experienced nurses, or even myself, you can look at a formula fed baby who in the growth chart are over a certain level. You could look at one who is formula fed and one that is being breastfed exclusively and look at the two of them and can tell. There's a difference to how the nice and chubbiness look. The breastfed babies tend to have sort of a, I wouldn't even know how to explain it, but it just looks different. Okay, so breastfed babies, they do gain a certain amount of weight within a short period.
Yeah, that's natural. Then it fall off. Naturally.
And then it's fall off.
Okay, so ladies, is there anything else you'd like to speak to the people about?
Well, last time I forgot to say it, and I feel I have to. Because again, I trying to be, like, we really have to be realistic and look at different people's expectations and their fears. And a lot of women have this fear that the breast's gonna sag for real. But when you breastfeed your child, when you have a child, like for me, I decided this is a gift that I'm going to give that child. And it pays dividends the whole life. It pays dividends in your health. But I'm sure we live in a modern time that my theory is if you don't like something, fix it. We have Dr. Tokushel here. He is a plastic surgeon, and it's called a breast reduction. That's a lot of people have it. It's a simple surgery. It's not that expensive. If it came down to giving my child this amazing gift, I'm going to do it. In a few years, if I don't like it, I get a nip tuck and I'm good to go. We're living in modern times. But do not sacrifice the health of your child. It's such an amazing thing. Yeah. That's my little two piece. So all of you there who's still saying, no, my titty going on.
Yeah,
that's the solution.
And my message is, I don't mind the saggy breast. Once it's from a child, yeah, I don't mind the saggy breast.
I would just encourage,
ladies, love yourself.
You know about Dr. Tokushel, though.
But I would just encourage everybody, breastfeeding, like you said, what you keep saying about it, it's natural.
Yeah, man, it's natural.
It's the natural.
It's a natural order.
So I would just
for real. No,
yeah, no,
look,
but I like that. I
look
like
at
that
everything.
Yes.
No, but look at animals. When a goat man, they find the titty. Nobody got to find
Nobody have to find it for them.
When a pig, cow, everybody. Every animal.
And they don't have no other option. And
There is
they
no
go
other
just
option.
fine.
Yes,
So it's the natural order of things. So I'm just encouraging persons to remember the importance of breastfeeding.
Yes.
Remember, we have teeth in the mouth to bite and the tongue to push. We're not born with teeth.
No.
So naturally, the breast is supposed to
Yes.
that's the natural order of things.
So I'm just encouraging everybody out there, and it's not just about mothers who are breastfeeding, but also their support systems. Because sometimes you find you have individuals who want to breastfeed exclusively. However, you might have a relative or a friend or somebody saying, well, it's easier with family life. They have a premature baby. They might say, well, the baby might grow faster if you give them formula instead of breast milk, which is not true. So it's the natural order of things. I just want to encourage persons to continue to breastfeed. And if you haven't started yet, if you are thinking about becoming pregnant, get educated. Know what to expect so that you will be more informed and you will be more prepared for the journey ahead. Preparation is key, and one of the best ways to get it is through education. One of the best places you can get education is through the health centers.
Yes.
The services are free, so once you are thinking about getting pregnant, pre-pregnancy, you can start visit the health centers, you start going to the family planning clinics, and then when you become pregnant, you start going to the antenatal clinic where you will get all this education that is needed to help you through this journey. Okay, it's not only about the welfare of you, but also the welfare of the baby. So this is what we tend to do within health. So please utilize your health centers, get educated, get informed, and support breastfeeding, not just by saying I love breastfeeding, but also by encouraging individuals to do it, and also, if possible, when that experience come along, doing it yourself.
Yes.
So breastfeed, ladies. Make the baby suck the titties. If the titty long, doctor.
Taco Shell, and I'm sure they have more by now.
Right.
That's the only one.
And ladies, my little message for you. If the boy don't want the long breasts, I'll take them. Okay? Alright, people. And before we go, I would like to say thank you to Beauty 101 for hosting us today. An amazing spot.
Lovely.
Hey, I like this spot, And people remember to like, share, and subscribe. Hopefully, we can see these ladies again for another episode. Not a repeat this time, but another episode of the podcast to speak about something different. Health is wealth. You know what I mean? And my doors are always open to the ministries to speak about what they have going on. And we need to organize that sex session. Because music festival, them try to catch me, put on condom and dildo and everything.
That would have been the age.
But we need more education for the public and the younger people too, because a lot's going on. Everybody is exposed to adult stuff these days. Yeah, so if you're exposed to adult stuff, you need to be exposed to adult information also, right?
Of course.
Right. Anything else from you, ladies?
No, I just agree with you with the education aspect of it. The persons need to be educated properly in order to make an informed decision.
Yes.
Right.
So we can't assume persons don't know. However, we try to provide them with the education so that they can understand that with some actions they have consequences. And that they can be more aware of what's happening around them.
And be truly empowered with knowledge. And the Ministry of Health, we're on as you said, a public education campaign, and we're not just doing it in the usual ways. When we finish here, we're off to another radio station, and we're really trying to connect with the communities, and as you said, to empower people through knowledge.
All right. People remember to like, share, and subscribe. This has been another episode of the Perspectives Podcast.
Hoy, and I said nobody now believe it. Well, if them here say I beat it, me and the pastor, me not go preach it to how we all it down. Yeah, man, it's Dejour, and I mean giving you a different perspective on Perspectives Media. Easy.
Perspectives Media.